So treatment for childhood cancer is based on the specific diagnosis that we get. And so there are different treatments that are more effective for one than for another. I would say a big difference in childhood cancer treatment compared to maybe adults is that a large percentage of children who are being treated for cancer are often enrolled on a clinical trial. That's not the case in the adult medicine world. And so for us, offering a clinical treatment research protocol is standard. And so the first thing that we're kind of doing when we look through, we have the diagnosis, I'm figuring out the plan, is what's available for this child from a treatment protocol standpoint. So there's one national organization, it's funded by the National Institute of Health, that is called the Children's Oncology Group. And the Children's Oncology Group is a network of all of us pediatric cancer centers throughout the United States, North America, and a couple other locations that are all working together to improve the outcomes in children with cancer. And so there's about 240 or so institutions. As we talked about before, childhood cancer is rare, and specific diagnosis within childhood cancer is really rare. So we couldn't, as a single institution, make rapid progress in the outcomes if we were only relying on our population of patients. No hospital can, because these are very rare situations. But all together, we can make a lot of difference and make rapid progress in the outcomes of children with cancer by enrolling children and families who want to be on treatment protocols. So we would offer them a protocol if there's one available, and then if they say that's not for them for any variety of reasons, so then we would look at the most recent clinical trial that had the best outcomes and what was that treatment protocol, and we would follow that. So we're still following, not from a research standpoint and not sharing data nationally, but we would go through and follow what the best treatment outcomes that we know of. There are often not just treatment protocols, but for example, there's a national childhood cancer registry that families can participate in just by giving how old's the kid, where are you from, where are you being treated, what's the diagnosis, what's the outcome, those kinds of things. And then there's a national biology bank or tissue bank where families can agree to any specimen that's left over. We're not going to do an extra treatment or an extra biopsy to go get more tissue, but they could agree that leftover tissue could be sent to a central tissue bank through the Children's Oncology Group for research to be done. So sometimes people can participate in just a registry but not a treatment protocol and so forth.